Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Dr. John Rosa is CEO of ABC Management, which is comprised of 16 integrative medicine clinics in Maryland and Virginia, and oversees over 70,000 patient visits per year. ABC clinics combine medicine, chiropractic, physical therapy, acupuncture, and behavioral medicine to give a comprehensive multidisciplinary approach to patient care. Dr. Rosa is active in sports medicine with consulting and treating athletes in several universities, the NBA, Major League Baseball, National Hockey League, and U.S. Olympic basketball teams. He is board emeritus to Northeast College of Health Sciences and is current chair of the board to Maryland University of Integrative Health. Dr. Rosa is an international expert on the opioid crisis, lecturing and consulting on the topic for the past 8 years. He has served as a White House surrogate to the opioid and mental health crises for several years, and is a state and national consultant to opioid task forces for Homeland Security, CBP, DOJ, DEA, FDA, FBI, and U.S. Postal Service. His work has led him to found Overdose Free America, a nonprofit which works with Hollywood and music industries to combat stigma around addiction. Dr. Rosa is chair of the board of the Same Here Global Mental Health Movement, a nonprofit which uses the power of professional athletes and celebrity influences to normalize the conversation around mental health and addiction. Well, Dr. Rosa, thank you so much for joining us. It's great to see you again.
Oh, I appreciate you having me on. I love the work you guys are doing and messaging, and it's an absolute need in society today. So thank you.
Well, you're entirely welcome and deserving. And I was hoping you could start us off by telling us a little bit about how you got into the work you're doing and what drives your passion for it.
Yeah, well, I've been integrative medicine for 30 years. In fact, December 3rd, which is 5 weeks away, will mark my 30 years in practice, which I still shake my head over and can't believe. But so most of it's been in the pain management field, a little bit of behavioral health overlap. I did some research in my undergrad times with some of the polyvagal stuff. So I always took interest in how the body, the brain, the gut, the entire systems work. So it was an eye opener for me, and I just stayed with it and followed. And there's an overlap on a lot of things when it comes to behavioral medicine and pain management. Those areas of the brain are cousins living in the same house, right? So that's been kind of my focus. And I opened up a couple of clinics. My brother's one of my partners in the DC area, mostly in Maryland, Virginia. And there was such a need and no one doing and some out of the box kind of approach to holistic health, pain management, behavioral health. There's no one really in the area doing it at all. This was some time ago. And we started opening up clinics and training some of the other docs to kind of have similar ways of approaching that type of healthcare. And we're now at 16 integrative medicine practices in the area that have medicine, chiropractic, physical therapy, acupuncture, behavioral health. So we've kind of got a good eclectic group of professionals that are making a difference. I've been lecturing on the topic, started with the opioid crisis, then addiction in general, and then mental health overlay on those, how they collide in their paths. And I was at an event for the state that I was doing, and a representative from the administration at the time, it was somebody from the Obama administration, had asked if I would speak at one of their conferences, and then I did. And then I became a surrogate to the White House for a few administrations, and that's kind of where my expertise, when you're asked to be at that level, you can consider yourself an expert in anything, but when they're asking you to be there, you better do your whatever that 10,000 hours makes you an expert. I'm not sure, and this is not out of conceit. I'm not sure if there's a different category than expert, because it's a heck of a lot more than 10,000 hours that I've put into the topic. So that's kind of been my roadmap to where I am and what I'm doing. And I love every minute of it. It's exhausting. And we talk about addiction, overdose, suicide, mental health. Those numbers, as you know, every 6 months when we have our meetings with CDC and the rest, they're going up and not down. So it's a very difficult battle, but a battle that has to be fought nonetheless.
Well, and I saw one of the most recent, I don't know whether you call it a newsletter or a blog post that you put out related to one of the key factors there, and there's social connection versus disconnect, and what are you learning about that in terms of what's helping us?
Yeah, look, I really think that's it. Like we can't always be at the water's edge of a 3,000-foot fall for the waterfall. We can't just keep pulling people up as they go to their demise. We can't build rafts in the middle of the water and try to put them on there for safety if we don't go all the way up and see who's pushing them in or are they jumping in, right? So what actually causes the chain reaction of things that lead to addiction, mental health issues, anxiety, depression, suicidal ideations? We're not talking about the diagnosed 1 in 5 who have this, 1 in 5 who have that, 1 in 5 have bipolar, 1 in 5 have depression, 1 in 5. To me, it's a little bit of BS. It's really 5 and 5, right? It's 5 and 5 of all of us have some level of mental health. So physical health, we know, because we went for an exam. We know our systems are good. We go to the gym and it's physical health, and it's mental health. As soon as you say it, people are like, who are you pointing at? Where's the crazy person? That's not it. Mental health is mental health. We all live in a continuum of up and down, and we have it. But community in and of itself, in your question, it's a breakdown of what we look over. We're 500,000 years of an evolutionary process that's protected us of a species that has not disappeared for a reason. We've been communal. We feel safe, which is a very big word in this space. Safety is literally the net. And safety doesn't mean I'm not in danger. Safety means my community, in somewhere within the way our nervous system works, understands that this is where I'm supposed to be. I'm contributing to this part of my society. They contribute back. We got this. That's been completely disrupted. I mean, look at the tribal instinct of how groups have formed over those years. So everyone has a role, right? Roles are dissipating every day for us. Most people are not even understanding where their position sits in society or within their family or within a relationship. We've kind of gotten away from the identity part. And then it disrupts our neurochemistry to no end. Like, we're supposed to have those, I call it the dose, right? Dopamine, oxytocin, serotonin, endorphins that are released. Those chemicals literally keep us alive, survive, flourish, engage, happiness. Parasympathetic response of living in a very good state is all based on that dose. So when the hunter got up in the morning and he got to hit a dopamine. And when he said, we got to hunt, he gets a hit of dopamine. When he grabs his people going with him, they get dopamine. Grab their weapons, they get dopamine. In the field, they see a bison, they take off. And endorphins are released because what you don't want to feel is what's underneath your bare feet. So you take off and then you get this thing, you get the animal, and serotonin is released because that's the one that makes you feel like I am part of something bigger. I am going to feed my tribe. I know they're going to be happy with what I've done. I feel good. I'm contributing. And then you bring this thing back to the tribe and everybody's happy because they're going to eat for 3 months. And one of the ladies strokes the shoulder of the hunter and says, thank you so much for doing this, because now we're surviving. Oxytocin's released. They're in a tent. 9 months later, you have a baby. Now it sounds cute and it sounds funny, but literally without what I just said, that neurochemistry, without it as a community that normally is produced, because let's think about that tribe, right? So when they come back, there's the woman breastfeeding right out in front of everybody and saying to herself, you see this? Without it, we don't survive. There's the other person who's the gatherer, brings stuff to the end, and he's smiling ear to ear because he knows without this, we can't survive. So everybody had their kind of positioned within their community to make them just feel safe, okay, engaged, and helpful.
Now, when you say that, what sparks it in me is how are we supposed to know where we are in this? And I think about assessment devices, the ones that we studied for psychology, hundreds of questions and have to be administered by a professional, et cetera. And one of the things I like is with Same Here Global, and you're associated with them, they've got an assessment technique. 1 Million Lives has an assessment tool, not technique. And it's something that people can self-administer and have, like, we step on the scale, we check our blood pressure, we check our pulse, but we don't do that for our mental state. Can you talk to us a little bit about the simple assessment device that, for instance, Same Here
Yeah,
Global uses?
yeah. So, and thanks for asking, because it has really been the data we're collecting and the people we're helping has really been amazing. And it's going back to the KISS method of assessment, right? Just keep it very simple. And especially K through 12 colleges, coaches with their teams, corporate settings with HR, trying to keep their temperature on what mental health looks like, especially when we're under the changes and the duress that societally that we've seen. But to ask somebody how they are, the answer is always, I'm fine, okay, I'm really, no problem. Meanwhile, there's the demons flying all around you, like Linus with his dusty blanket. It's just, it really literally is everywhere. But just simply asking somebody on a scale that's visual. We have simple emojis that have descriptions of what those things are, and they're ing words like thriving and fluctuating, and it puts you in a sense of not picking something specific. The scale doesn't have a center part, which most people just drop to the center because they don't want to admit that they're not doing well, or they don't want to even admit that they're doing really good sometimes, right? So one, and two, it's on a device. Like it's literally it's in your hand. And most people from now 50 down are used to using something here. Also, we're used to this being the unhidden truth of what your brain is thinking. And what I mean is, if social media, you've seen friends or family or others post things and say, wow, they would never say that to my face or to other people in public, but they feel empowered to get their feelings out that way because it's sitting here in this protected thing, right? So that's a bad thing in some senses, but here it's a good thing, because when you have it in your hands and there's something you could do in the privacy of your brain to this phone, and you measure on a daily basis where you are. And with the schools K through 12 and some of the colleges and even the personal app that they've developed, it taps and measures, and it's taking that data in the background where you are. So if you have somebody that's been pretty much in the same zone, and then for 3, 4, 5 days in a row something's dipped, it triggers the teacher or the social worker or the professional that oversees the school itself, or a parent who then is tied into a child, to be able to see, okay, the dip's there. And that doesn't mean we measure to run and make an appointment for med management. That's got to be the worst thing that we could do. What it does is says, okay, everyone in life goes up and down. There's somebody here who's now on the down and is kind of stuck there. Let's have a conversation to find out what it is and bring them back to a normal homeostatic state of touching both, right? Because you could be picked for the basketball team and no one ever picked you, and you're up on the top of the way you feel ever, and go home and the dog passed away. So it's quite normal to have the ups and downs and dips. But if we don't have that conversation with people or measure it so that there's an indicator that you're stuck, then it's hurtful. But yeah, those type of things are really, it's not all doom and gloom. There's organizations like Same Here Global. I have a Overdose Free America is another one that I myself started, and we've kind of connected those together. So we look at addiction and we look at stuff in mental health, and there's a lot of nonprofit work. There's a lot of really cool things coming out. The digital age has caused a lot of confusion and probably contributes to some of the problem. But at the same time, there are things that are being developed that can help in an incredible way.
Yeah, and we have Mad in America, is a place where people can go and start telling their story. So people who've had lived experience of significant mental health issues and how they overcome and are overcoming,
Right.
they can share their stories and they can connect with people. And Amity, there is a thing that the Journey's Dream people started to try and help people connect socially in a platform that's not going to be driven by some algorithm to shove them something to sell
Right.
them, right?
Exactly.
But just to connect with people on topics that they have an interest in.
Mm-hmm. Yeah, it's interesting because at Same Here Global, the origin of it was Eric Hewson and his story, right? So we have this business executive in the sports world who's touching at the highest level in basketball and at the NBA, and then he was running second man command of a hockey team in the NHL, and then crashes and burns and just 2.5 years in bed and 52 combinations of psychotropic medication and electric shock therapy at the end, and nothing worked until he found some other integrative modalities that actually made a change for him. And it was a beautiful story.
If I remember correctly, the thing that really got him on that path was somebody sent him to like a weekend, how to breathe therapeutically.
Yeah. Yeah.
It's just amazing how powerful something like that can be when all
Simple.
of these other things just hit a wall and did nothing for him.
Right. I mean, and that's like I say, the 4 and 5, right? Well, 1 and 5 have these diagnoses, but what about the 4 and 5 who are just sitting somewhere that we need to hug? I mean, the guy told the story. It's funny, that weekend retreat he went on, he was the only male. He was the only American male, and there was yoga mats and about 11 other small Indian women, and he's about 6'7". So it would have been a great like thing to capture on camera, because it must have been the funniest thing to see. But wow, did he take it seriously, and it worked. But when he started this, and he was so like worked up over these modalities that helped him where others didn't, so he went on LinkedIn before there was a character limitation, and he told his story. It was really therapeutic for him, just because he wanted to just get it out. And it was like a 45-minute read. I mean, this was a story, and it told his history, the ACEs he experienced, the trauma with his brother being ill with cancer, and
now, I just want to clarify for people, ACEs refers to adverse childhood events.
Right.
And it's critical to most of our life stories that we learn to recognize. Even if we don't have a major trauma, we've got a lot of little things that build up where we end up feeling less than capable of dealing with it. And that's how it contributes to our either health or struggles. And that's the ACEs. So he had quite a few ACEs,
right,
that didn't happen directly to him, but they were in his immediate family. And so nobody ever, that was another thing about his going for help. When he finally went for help and somebody sent him to the breathing thing, he said that was the first person that asked him, so what's going on in your life? Rather than what symptoms are you feeling? And then I have a med for it.
Exactly. You are absolutely spot on. And that was basically what he was saying. It was just, here's my life and what happened. Here's the brain doesn't have a delete button. You have experiences, and you either neuroplastically place them somewhere where the bad ones go somewhere and hide, or they have the way with different things that you may see, touch, smell, triggers that bring them back, and there's feelings that come back to the surface, and you don't even really know that they're there. But the thing is to recognize that that exists, and then you can control it better. So what he got was like thousands and thousands of shares, and then like 600 or 800 people that reached out. And the common thread was not, oh, I have bipolar 2, I have schizophrenia, I have anxiety disorder, I have major depressive disorder. They were all people saying, I lost my child to SIDS, my parents split up, and they were drinking, and it was a bad household. I lost my college love, and I'm married with 3 children, and I'm very happy, but I can't get this pit out of my stomach. Like, it was amazing that everything that came in was just shared lived experiences of what the norm is in what we call life. And the beauty of it was just him then saying, are you kidding me? This is not about symptoms to name disorder. It's about life experience that make you symptomatic. So anxiety doesn't need to be a disorder. We're all anxious, especially now. Depression doesn't need to always be a disorder. We just have depressive states that we fluctuate through. So, so we need to go towards the symptoms and see where they may come from and understand them better, because education of understanding is the key to everything, really. So I'll get a quick example on what that. An ice bath, right? Like when we told our athletes, and I treat professional and Olympic level athletes, 15, 16 years ago when the studies came out about ice baths, that cold temperature relieving like lactic acid buildup and exudates from a heavy workout or a game, and then people not recovering quick enough to get a better workout the following days. And when we told the athlete we're going to put you in an ice bath, they're like, yeah, sure, doc, right? I'll do a polar plunge, but for money for you, but I'm not getting in an ice bath. And then you sit them down as a group and say, guys, look at simply what this does. This is how it removes the exudates, the lactic acid. It makes you better, stronger, faster. You can play better, work out better the next time. Well, they jump in an ice bath. When the ice melts, they ask the trainer for more ice. And what was it? It was just simply giving them the brain power to understand what is happening. And I think that's here a big part of the hope, is that when people are locked into mental states that lead to addiction or suicidal ideations or anxiety and depressive feelings, if we open the door of reality, of plasticity and understanding, homeostasis, that we touch bad and we touch good all the time, it helps just make you feel like, I'm not alone. I understand. Tomorrow could be better. And it may be not, but it doesn't matter. There is a light at the end of the tunnel, and it's not a train.
Well, and you talk about so many things there, the neuroplasticity, the brain's ability to change and adapt. That's what it does, right? Learn and
Yeah.
change and adapt, and learn and change and adapt. And when you think in terms of, we are taught that the outside events cause our upset or our emotional response. And if people are given the tool, it says, like you educated the athletes about what the ice bath would do. If we educate people about how their choice of how to interpret and respond to the life events is far more powerful a creative agent in what they experience than the actual event. We can empower people to make a change when they start to feel these things go up and down within them.
Yeah.
And so I love the fact that the Same Here Global has an assessment device. I mentioned the 1 million lives, OML.live or .org, but this is an engineering company with thousands and thousands of employees, where one of the higher ups said, wait a minute, I was talking to one of the smartest people I know, and they talked to me about one of their life events dipping and their mood. And I thought, this guy has a problem. The next thing you know, he develops an assessment tool so people can take it several times a week. You can take it daily if you want, to assess, how is your social connection? How is your sense to your family? How are you feeling physically? We check that, what's my temperature, what's my weight, etc. But also, how am I feeling about my use of social media or television time, or the things that feed me, this quiet reading time or connecting with a friend. And you can make that assessment on a regular basis and then figure out, oh, wait, I've been feeling down. Maybe it's related to these things. And I just start to even those things out a little bit. I don't have to make major life changes to feel better, to connect, to get a boost of what you're talking about, either the dopamine or the serotonin or the oxytocin.
Right. Absolutely. Look, what is the destroyer of those chemicals being produced, right? It's the cortisol driven cytokine systemic inflammation system. It just cuts out the normal production of all that, right? So when you're measuring and you have these tools, which are beautiful, you're visually understanding where you're moving up and down, and it actually affects your production of cytokine. So if we look at what happened with SSRIs, this is a good example. Like all the studies now recently coming out saying it really doesn't work. Well, it works in some cases. You can't just blanketly say it doesn't work. But where is the process that they're looking at, and how does that work? Well, there are the serotonin reuptake inhibitors. only inhibits the serotonin from being uptake again into the system so it's more readily available. But what if you're not making it at all? Right? I
Right.
mean, if you don't produce it, who cares if you're stopping the reuptake? It's just not even there to be uptaked or kept in its place anyway. So it literally, and what is the major reason of lack of production? It's the gut, obviously, leaky gut stuff. Serotonin is a lot of it's made in the gut, and we have issues with our digestive system. But what happens is cytokines, when they're produced, and I could go into a few examples of why we're massively producing them as a society, they don't allow that change from tryptophan, 5-HT, 5-HT to serotonin. Literally, the chemical reaction to get to serotonin is cleaved because of cytokine, interleukin 1, TNF factor, all like IL-6, IL-2, like those cytokines just stop you from the ability to produce serotonin. So where does that come from? You have sun avoidance. We're not going outside. We're not getting the fresh air, the sun on our face, the production of vitamin D. We're eating ourselves out from comfort food to sugar to the rest into the country 50% obese, 75% overweight, very pro-productive of cytokines. Yeah, chronic pain and stressors to joints and the rest increase the cytokine production. You got aging, which is something we can't control, but that also does the same. Sedentary lifestyles, no movement, not moving around produces it. Refined sugars, flours, carbohydrates does it. Sleep loss, circadian rhythm disruption, smoking, these are all pro-productive. Then what is the biggest factor in the middle of all that is when any of that is churning, the mental state and emotions of people, if it's depressed, feeds into overproduction of cytokines too. That causes chronic, it literally is the root to disease states, brain fog, mental illness, pain, heightened sensitivity to pain. So when you look at really the reasons why things happen, we can do this to make someone's mental state feel better, along with the assessment tool, along with some things you can do by just giving them anti-inflammatory lifestyle, which means get out in the sun, move and exercise a little bit. Here's a better diet to do. Don't think so much. Let's teach you and understand why your nervous system is overreacting to certain things. Don't smoke. All the things that we know that are allow then the brain to be normalized in a way that makes them feel human. Then the education part we spoke of just earlier is so much easier to let that light bulb go off and neuroplasticity to develop new highways of emotional freedom versus emotional stress. It just becomes easier if you taught them just the small things, like this isn't really, it's the brain, but it's not like brain surgery. It's so simple to help people. We miss the boat every time. It doesn't need to be a medication or some crazy modality to do something to change the brain. It's that community. Going back to the first question you asked me, it's enough people around you to understand that the simplicity of things, of life, of connections, of being out in the community, doing things, eat right, eat well, move as much as you can. Your serotonin production is going to go up just in and of itself. And then you have the ability to learn and educate yourself to do well.
Absolutely. And the thing about it is, what most people don't understand is the best results I've seen in my own life and with my family, friends, and people I've worked with over the past 48 years are the people who make significant little changes in increments.
Yeah.
They don't say, okay, no more sugar. I'm going to run 5 miles every day,
Yeah.
twice a day. I'm going to dump all my old friends and get new ones that are healthier living people. It's just little incremental changes in some of the things you've mentioned. I loved Dr. Mark Hyman did an interview where he said, as you said, this isn't rocket science. What it takes to live a healthy, well-adjusted, happy, or joyful life for a human being. We know about the food and the water and the sleep, but it's also a sense of connection to community, a sense of love in your life, a sense of purpose. And there are ways to get those without you don't have to be, a surrogate to the White House to have a sense of purpose in your life.
Right. Exactly.
Right?
It's so true.
Each of us has things we're somewhat good at, and then excellent at. Gay Hendricks talks about if we stay at the stuff we're excellent at in that zone of excellence, we accomplish quite a bit, but we aren't always as happy as we could be. If we find our level of genius and spend a little bit more of our time in that level of genius, the level of genius for whoever is not a genius level intellect. It's something that when a person does it, even if they're only average intelligence, as it might be rated by our psychologists, when they're doing that thing, time disappears,
Yeah.
right? They just, they feel like they were doing it for hours and it was only 10 minutes, or they've been at it for hours and it only feels like 10 minutes.
Yeah. Well, that goes back to the neurochemistry, right? Because
Exactly.
when you get to that spot, the neurochemistry is completely changed. If you functional MRI'd somebody at the time of where you're saying they get to that level, the amount of normal neurochemistry that's needed is exponential. The problem is the people don't realize they can get themselves to that state. But most are stuck in such a place that when they're exposed to something externally that gives them that, they dip to it consistently. And that could be drugs, it could be alcohol, could be gambling, could be pornography, sex. I mean, there's so many things that do the chemistry burst. But if they just realize that within themselves, there's this control mechanism of getting from level to level, and it's teachable, that helps much better. And in tiny bites, like that, like the elephant, you bite, how do you eat an elephant? Tiny little bites at a time. That's really what you got to do here. You just get that level of neurochemical change and neuroplasticity change to take you to a better place. The trouble is that we're so depleted. We're so depleted. I mean, think of the nervous system, right? How it's the autonomic nervous system is such a beautiful thing. It keeps us fight or flight, like to be in a sympathetic state is very good because it saves your life. You're supposed to run away from the tiger.
Right.
You're supposed to fight the thing that's in front of you because there is nowhere to run. That response is genius. It's literally how we survive. But you got to be parasympathetic as well, which is what? Feeling harmonious, joyful, rest and digest. And that's where you regenerate your batteries and everything is okay. And then when you get exposed to that thing again, you hit the sympathetic response because you need to keep doing that. We're not supposed to have a tiger chasing us every day, all hours of the day, even through the night. What happened? Like, we're not, you got an election cycle that was crazy. So if you voted for somebody I didn't, we can't laugh and debate about it. We hate each other. We take family members, it's unliking on social media to each other. Strife in the streets on both sides and making insanity that you see on a 24-hour news cycle. Mask. Should I wear a mask? You should wear 3 masks. Better to have 5 masks. Don't wear a mask at all. They don't work. Get a vaccine. Vaccines don't work. They're going to kill you. You'll have a heart attack. No, you should get 7 boosters. Well, I work stocking shelves at the grocery store, and if I get COVID, I live with my grandmother. I'm going to kill her, but I'm essential. I have to go to work. Like, what? I mean, how do you? No school, parents with the kids in the house on a computer. They only have 1 computer, and they have 3 children, and the house only is 1 bedroom, 2 bedroom. Like, how does that even control? Then you don't go to work. You're working from home, which now is becoming a new norm. There's no social engagement or activity.
And when all those things become the focus,
That's it.
We live in such a heightened state. There's this video people can watch on YouTube. The title of the video is Stress, Portrait of a Killer. And it talks about exactly what you're talking about. It's in about an hour format. We were intended to be able to fight or run away from that which might harm us and stay in that heightened state for 5 or 10 or 15 minutes. And at the end of that, either the threat is gone or we are, right?
Right.
It's okay, right? Either way, we survive
Right.
or we don't survive. But this physiological system and the energies around it that we call ourself, our mind, our heart, our loves, our passions, our thoughts and emotions was developed to be in mostly that parasympathetic state.
Right.
And so when we can focus on things that can boost those brain chemistries, like, in this Integrative Mental Health Summit that you were a part of a few weeks ago, also Dr. Barry Ryman was a part of it, and he works with Recovery Unplugged. And one of the things they do there is they recognize that for many people, the use of music stimulates the same good kind of brain chemistry that we want, right? If that we would get if we had a great success or that we fell in love, and so they use things like which musics, which rhythms, which movements help stir that brain chemistry.
Right.
And when we shift away from everything that the media and the quote news would tell us, so that we don't spend too much time, like you were just describing, in that heightened, frightened state.
Right.
But then we are empowered to use certain things that we can sing along to or find on YouTube or
Sure.
weave into our lives in different ways that restores that kind of flow and balance. Then we get a tremendous improvement in a relatively short period of time.
In some cases, instantaneous. So it's vagal tone, right? So the vagus nerve controls that parasympathetic response and then gets diminished and shut down when we're in that sympathetic state. So that vagal tone is critically important. And to give like an analogous kind of example to any human being to understand, to keep it simple, is that feeling of looking in your rearview mirror and the lights go on and the police officer you're thinking, I better be someone else. And it gets behind you and you drift over the next lane and so does he. And now you know it's you. You get sweaty palms, your heart's beating fast, your eyeballs are like this, your pupils dilate because it's that sympathetic response of, oh my God, your brain's not connected, but like, I'm in trouble, I got to get out of here. And you can't even find the glove compartment to open it. You don't even know how to open it. You can't, do I press the button? Where's the thing? I got to get and he comes to the car and he says, hey, Dr. Rosa, I was one of your patients before. I was just there, one of your taillights out. I was stopping you, but I'm glad it's you. Get that taillight fixed. It's awesome. It's really good to see you. And he walks away. And you go from complete panic to that almost euphoric, the birds are singing and music's playing because you feel like that's the nature.
And it would be great if more of us could do that. But what we're finding is that people have been trained into the negative thinking so much that some of us leave that situation and we're like, why did that have to happen to me? And we make it ruin our whole day because we focus on, I can't believe why, that guy should know better. He should know what's going to do to my immune system.
Right. That's the ruminating thoughts, right? That you're right. You get your ruminating thoughts. People get stuck because they're stuck there. They were probably already there when they were before they got pulled over.
And it was just below the level of consciousness. They weren't even aware they were living at such a high stress level.
Right. Exactly. Yeah. So the things that can immediately change that vagal tone are the things that stimulate the vagus nerve. Why was the vagus nerve that the long traveling nerve of our system and the control factors, and why did we develop in a certain way to understand safety, not feeling in that sympathetic response? It's this, like right now, we're in a vagal tone that's very comfortable because my pitch to you is up and down, and I'm tilting my head, and we're smiling at certain points and laughing about some things, and you're nodding, and because you're understanding me, I feel like I'm educating you or some of the viewers that will see this, and that's an amazing parasympathetic vagal response. Even the vagus nerve that goes to your ear, inside your ear, the facial movements and expressions. If I was staring at you like this and my tone was that way, people would listen to this and they would leave and they say, was that Halloween, or was this what that guy's dangerous? Because the vagus will respond to the different responses seen. When people were masked up for how long, children that were getting their social cues and comfort and safety couldn't even see expressions of what people had, and eyes are not very good to look at without the rest of the expressions. So the vagus nerve, in stimulating us to be in a okay place, which produces better neurochemistry as well, those things have been off. They've been terribly off. So things like, like you're saying, when we have these the STAR exercise, like stress, trauma, active release, and rewiring exercises we have through our same here, Global Mental Health. And it's on the website. People could buy these cards, explains how to do them. And initially, when I went in and I was chair of the board of the nonprofit piece and looking at all the stuff that they had, I'm like, wow, I know of all these modalities. These are brilliant, these cards. And I wanted to try some of them. And I'm like, well, the singing bowl relaxation, I'm not gonna sit there with a bowl and go like what makes this noise and I do this. I'm like, what are you kidding me? And then I went and researched the way each one of them worked. So I took a look at it and I said, wow, that tone stimulates the vagus nerve based on the way the sound comes into the ear. And it immediately takes people from a sympathetic state to a parasympathetic state, an enhanced meditative state. I'm like, this is brilliant. But this is stuff that people have been doing for thousands and thousands of years in simplicity, tapping, havening techniques, breathing, deep breathing for calmness, chanting, dancing, like the tribes that would go around a fire and do these movements and hum and have a hum, like a hum.
And the people that would drum all night long. And they're in the flow, and it just, and the whole community gets in that flow. They entrain the rhythm and the brain chemistry, and it's just amazing.
And simple though, right? I mean, the reason that we don't see it anymore is because it's just too simple. We complicate everything. It's just insane to me. Like a pill for every ill should not be the case. Like when I lecture and I'm in front of medical doctors, physical therapists, chiropractors, whatever associations bring me in to lecture. And some of the medical conventions that I lecture at, I have a couple slides that don't make anybody too happy and I get reactions, but then they come and talk to me afterwards because they say, look, let's think about what complementary and alternative modalities or medicine is versus traditional. Like, okay, so for thousands, in some cases 5,000, 10,000 documented, or acupuncture and oriental medicine, deep breathing techniques, bone setting, which is now chiropractic and osteopathic medicine. All these things have been either written or on the walls of caves for thousands of years. We don't drill holes in people's head to let demons out anymore. It didn't work. It didn't last. It went away. But so now in the last really 50 years, maybe 100 years for sure, but the last 50, everything is based on symptom prescribe. You tell me collectively, who's complementary and alternative to all the traditional stuff that's been going on for thousands of years that works? It's medicine. Medicine complements and is an alternative to the things we have in our pockets that can help society already because it's been done. Now, that doesn't mean I'm not pushing medicine and things that, look, without hospitals and the procedures and surgical stuff and medications and the things that we've developed, I mean, it's unbelievable. It really is amazing what we've done in healthcare. It's just science just keeps blowing me away. But in pain and mental health, we've got it wrong over and over and over and over and over again. Antibiotics will kill a bacteria infection, but an opioid pill of 30 days of OxyContin or Percocet for a pulled tooth or a shoulder for raking leaves. Come on, really? Like, there are areas that we see where mental health and addiction have just blown way out of control because we're going after it chemically and not humanistically.
Yeah, and the idea that so many people have benefited when they get off of those prescriptions and then move into, let's do some movement, let's do some breath work, let's, realign the spine if you like the chiropractic work. Dr. John Sarno's work about
Yeah,
tension
brilliant.
myoneural syndrome, where he recognized that if you're carrying a mental emotional tension in a muscle fiber in your shoulder, your neck, or your low back, and that spasm tends to cut off the blood flow as little as 5 to 10% for a short period of time, it initiates excruciating pain.
Exactly.
And that's not because you have a broken bone or a severed nerve. That's because you're holding mental emotional tension in the body.
Right. Right.
And if you learn to breathe and soften and talk to it, it'll either move to a different part of the body or it'll dissipate. And he was a medical doctor, he was a surgeon, so he knew that broken bones don't travel around the body. So when the pain would move, he'd know, oh, this isn't about a physical damage to tissue. This is about that tension creating the excruciating
He
pain.
was brilliant. He's a brilliant guy. And in his work in just understanding was then a Harvard study of what, why, and how. That's actually the truth. And they tied pain, anxiety, and depression, the same exact circuitry within the brain is that's all together. They're all cousins living in the same house. And that's the reason you're getting the expression and overlap of all, because they literally are the same wiring system and communication within the brain. And again, it goes back to the simplicity of understanding. So if we know that emotion and stressors and daily life activities and experience affect our level of pain, you subconsciously have a way to control pain. And the opposite. If we know that pain is going to lead to the expression of anxiety and depression and mood disruption, then we can limit those because we understand that they're connected. So when we're talking to all of them individually and we're in the room and you tell all of them, I'm not going to allow you guys to have a party today or next week or for a month. You've been partying way too much. Now you're in my house. You could stay, and I know where you are and who you are, but I'll hang out with you one at a time. And it sounds silly. I know I'm making it like oversimplified, but that's 50% of everyone's problem that I see in either behavioral health or the pain management side is in their head.
Yeah.
When I remove it with simplicity, the 50% that's real now and that's sitting in our face, it's much easier to work on that
Exactly.
than the whole,
So because we're up against the time limit, why don't you take a breath and settle in and think, okay, so what is an aspect of your work that we haven't even asked you about yet, and or something we've talked about already that you want to highlight and review for our audience before we wrap this up?
Yeah, I mean, I really think the most important thing of everything we just discussed is the simplicity of things that are available. And it's not, look, I fight all the time. And when you train for a game or you're in a war and you lose every day, the numbers go up. The number one reason to die in the United States of America, if you're under 50 years old, is an overdose. The number two reason to die in the United States of America is suicide. So the number one and number two problems that we have
for people under 50?
Under 50.
Right.
So the number one and number two problem, it's not COVID, it's not heart disease, it's not an accident, it's not cancer. It is overdose and suicide at the rate of almost 400 people a day. A day. Now that is ugly.
Which should strike us as preventable.
Right, that's the point. So hey, there's the bridge, right? What I just said is ugly, depressing. What's happening? The numbers are getting worse. You're fighting a battle you can't win. Why do you bother? Like, this is like, walk away. What are you doing? You're going to make yourself crazy. No, that's not. As the numbers are going up, the people like us and the community that listens to what this podcast has to deliver, they're the ones making a difference, because it would be 1,000 people a day. We have so many easy tools in front of us. The exclamation point on our conversation is There's help. It's everywhere if you just find it or have the right people like us talking about it. The simplicity of things are there. One is knowledge. Two is measuring, like the scalabilities, the questionnaires, the apps that are out there, like the Scale app that Same Here Global has. Then from there, when you're off on that scale and it's visibly not okay because you're tracking yourself, there's some simple things to do with it. It's not doom and gloom. You don't get stuck somewhere. Here's a bunch of things like the exercises you could do, the modalities that are available, alpha stim, which is alpha wave training. There's vagal nerve stimulators that actually help you with your parasympathetic. There's modalities, cold laser that they now do with this brain stem and the rest. So there's actually things you could do and simple techniques to do. I think if the takeaway is that, and I when I lecture, I punch people in the head with statistics because I want them mad. I want everybody literally pissed off, because if you can see what's happening in that mental health and addiction space, we need to shake that cage loud and clear that that's the biggest problem our country faces right now. And I also want to shake the cage and say, don't feel bad about it, because there's so many things you can do when you thought you had nothing. One, for yourself. Two, to deliver to your patient. You're wrong. There's a lot. There really is.
Wonderful. And one of the things I like to throw in when someone like you says we've got the alpha stim and the cold lasers and things like that, I like to remind people that they've got almost an endless series of things on YouTube where people are teaching EFT tapping, breath work. There's the Wim Hof breathing. There's a variety of people who will teach you yogic breathing, which is phenomenal for stimulating, as you said, the vagus nerve response and the calming. So, well, I thank you so much for being with us. It's a delight to talk to you again. And thank you so much for all the work you're doing.
Yeah, I know. And kudos to you again, you and your crew. Without this, you don't get the right messaging out. We're seeing way too much negativity on the 24-hour news cycle, and it's if you consume things like this, it brings you back to what really matters, and that's just social engagement and understanding and learning a little and feeling better about life, and not we don't see cats getting saved out of the trees on TV. You only see the bad stuff. So get these little bites of helpful hints, and that's a better way to live and have some reality reset. But thank you. Yeah, thanks for your work.
Thank you too. Blessings.
All right.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.